Oh, hi. Hello, everyone. I feel like Mr. Rogers in the friendly neighborhood. So I'm Dr. Claire Stagg. I am located in Indian Harbor Beach, Florida, and I know I have a lot of Trini friends and family all around the world that are going to be paying close attention to what I'm going to be saying. So I hope everybody's going to be happy. This is a first for me doing a live, so I'm going to expect to have fun, and I would like you all to have fun too. My whole idea is to go ahead and to make it to where I can have answers to the questions that everybody's been asking, that I have spent an inordinate amount of time in my book, Smile. It's all connected, whole health through balance. And I'm open to questions. I know I have a wonderful person who's helping me. His name is Chris Pernici from 321 Media. Chris is going to be moderating for me and giving me the questions. And so as I see them, I'll go ahead and answer them. The main question that I get all along is why this book? Why this encyclopedia? Why? Well, that's exactly it. I'm a white person, and I graduated in 1982, not to age myself any, and I studied in France. So therefore, I have a different overview of healthcare from Europe than the average American or American continent, both North and South America would have. The whole idea was to marry. All along as a child, I wanted to marry art and science and be my own boss and travel. And I found a profession that was no more anchoring the history of all things, because you can't get more sedentary than having a dental chair and tools. So what happened is it's been a progression between trying to help people and accumulate all the knowledge or funnel all the knowledge that I got through the years to where I can have a more effective healing process with the patients. I was accepted to medical school. In France, we had a competition to go into medicine, and those who didn't succeed did dentistry, and those who didn't succeed that either were either had another try or they were left behind. I got accepted to medical school, and I said, no, I wanted to do dentistry. Believe it or not, my fear was not being able to help enough people, or maybe killing somebody because I wouldn't know the right drug to give them. I saw myself walking down the halls of the hospital with this massive cheat sheet pamphlet in my white lab coat and saying, what drug do I give? What drug do I give so I don't kill them? And so I didn't want that either. I didn't want to be a pill for every ill. I wanted to do something more natural. And little did I know back nearly, 40 something years ago, that I could actually heal more medical conditions with dental and oral solutions that anybody could have thought of that time, that long ago. Now, what's interesting is that it was already being done in the last century. In the book, you'll see the book is divided into sections: the past, the present, the future. Well, in the past, we used to be called dental physicians. Dr. Al Fonda is the one who coined the term dental physicians. And we actually, what he's done is amazing. He actually showed how it's all connected. And what he did, he put it in a book, and he actually treated thousands and thousands of people. Another one who was very prominent in his time also was Weston Price, who was actually the American Dental Association president, who showed the relationship between nutrition, health, and airway and focal infections, root canals in the history, and hormone development, again, airway development. And the last one that I really liked a lot was Standard Processes founder, Dr. Royal Lee. So those are the ones that were mentors, if you will, that were very instrumental in getting this message across, because I wanted to make sure that it was understood that it wasn't me that was just spewing this out. It's already been done. It's got lost. They threw out the baby with the bathwater, and all I'm doing is trying to bring it back. So the goal was to go ahead and to show, hey, there's a whole body there. All right. You already have that innate power to heal. You already know, well, you may not know, but that's what the book's going to do. It's going to help you understand that you can ask the questions once you are aware of what you have issues with. Remember, what you don't know what you don't know. But once you know what's going on, then you can say, oh, I need to find XYZ doctor that can help me address this if you're unable to naturally with herbs or structural methods. I mean, there's so many different things, and all of them are in the book, by the way. Smile, it's all connected. So that was my little intro. I don't know, do we have any questions, Chris, or do I just continue talking? And if there are questions, please let me know. I do have a list by chat, so I need to go ahead and to open my chat. How long did it take you to put this information together, and who was most? Oh, well, I answered that question already, did I not? All right, how long did it take it? Oh, wow. Well, I graduated in 82, but my quest, I think I gathered all this information for many, many years. And when I married an American and came to the States in order to practice here, I literally needed to redo a dental degree, so to speak, without going to dental school. But the amount of time it took, it was as if I had. And I learned everything over again in English as opposed to French. So that was interesting. And then when I came to the States, we moved to Florida, and that's when I started doing what a lot of the American doctors were doing, where they were going to fix teeth and go to all these very, very prominent doctors who treated jaw joints and who treated the bite and who treated the bite and who treated the jaw joints, who treated the bite and who treated the jaw joints, and that was it. I was like, okay, but then why weren't the patients getting better? And so it's like, okay. Then I had a fellow church goer who was deathly ill and found out that he was mercury toxic because he worked in the light bulb industry, making signs for outside for the buildings. And because there are a lot of mercury vapors in there, remember the Mad Hatters in England when they made hats? The soldering and the silver and the mercury, that's how they soldered everything when they made the hats. So he got really toxic with a high mercury overload and ended up going to see a doctor, a dentist in West Palm. Now that's 2.5, nearly 3 hours away. And I was like, well, why can't I help you? I mean, I'm here. No, you have to follow certain protocols. So that was the dental part. Then we started talking about the chemical part. And then afterwards, it was like, okay, did that, started changing my practice. And that was back in the early 90s. And then I started finding different classes to go to, different things. And the same classes about jaw joints and teeth, jaw joints and teeth, and then nothing else. There was a doctor who told me about a technician whose name was Ken Guthrie. Ken Guthrie hooked me up with a doctor called Jim Carlson. So Dr. Carlson was the one that really opened my eyes up to the whole body connections. And Dr. Carlson showed the structural, and he brought to mind the theorem of Gouze that shows that the axis of rotation is at the COC1, which is the atlas, and not the jaw joint. Again, see, no more jaw joint involved, so to speak. So now we're starting to connect the dots. And I was like, man, this is really interesting. So if the neck is where you have the connections between the bite and the body, what else is going on that I don't know? And around that time, I had my babies late in life. It's just the way it worked out. And my 3.5-year-old fell and hit her chin. And I always credit Emily for being my impetus to go ahead and learn how to help her, because anybody who has a scar on their chin invariably will have a TMJ disorder. And it's like, okay, if you have a joint disorder, how do you fix it? The problem is, if you have a joint disorder back in the early 90s, the only way you can fix it was with surgery. And I wasn't going to let anybody cut my child open. So that started my journey to go ahead and work a way to funnel in how to fix the jaw joint properly. And I found Ken put me on to a company called BioResearch Incorporated. BioResearch was a resource for many different technologies, including electrodiagnostics, which had the joint vibrational analysis, which quantifies the frequency or the vibrations that occur in the jaw joints when the discs are off, or if there's bone loss, or basically if there's disease or a disorder or a dysfunction. And at that first conference, I remember my first person that I heard lecture was Dr. Stephen Olmos. And then the second person that day was Dr. Bob Walker, who coined the term chirodontics. Well, that evening I sat down and I was literally catatonic, and it was like, oh my God, how do I learn all this yesterday? Not yesterday, but 10 years ago, 20 years ago. How can I help patients, really, really help them? And that has been my journey since about the early 90s till today. Steve has been a mentor, Dr. Olmos, and he's always been at the back, you know, do this, do that, go to this, go to that. If you don't have the credentials, nobody's going to believe you. You have it all here, but you need to go ahead and to have the research to prove it. And so that's why I ended up then accruing a lot more diplomas, a lot more degrees. I did a lot of residencies, but the one that I have medals for, so to speak, they're all on the wall. There's a fellowship from the American Academy of Craniofacial Pain that took about a year, and then afterwards there was the master's at Tufts that took about 3 years to do. And what's interesting is that, yes, we started this journey back in late 80s, early 90s, and now here we are back in 2008. And when I was at Tufts, my dean said, Claire, because I was one of 11 chosen around the world to do this long distance master's program. And he went ahead and said, could you go ahead and prove that changing the bite will affect the direction you walk in? And I'm thinking, yeah, because that's exactly why he picked me, because I had a whole body holistic practice. And I'm thinking, okay, so the first year was a didactic, to where it was like a lot of research and stats and things like that. The second year was actually doing the research project, where I had them walk down the corridor and change their bite and prove it and do the stats, the data gathering. Then the third year, I was like, am I ever going to graduate? Because I couldn't find any data to corroborate what we were trying to prove. And what was interesting is, once we went ahead and he said, Claire, keep on going. That's why you're doing this. We're going to prove, because they did it in the clinic. We do it in the clinic. We do it everywhere. But there was no actual research paper showing this. So I continued, I persevered. And then one day there was a German doctor who had a leg length discrepancy, a meta-analysis. And she had in her paper 350 or nearly 60 references. And it was like the mega holy grail. Once I opened that paper and I started reading it, and I went to the reference section, each reference, remember 350, nearly 60 of them, each reference had 30, 40, 50, 60 references. And it's like, oh my God. And then as we were trying to prove how the bite is affected, or how the bite affects gait, I had to show how every body part I had to disclude. That means I had to remove every body part from the bite to show how they were connected, or I should say how they were affected, which was the big, massive funnel. That Smile, the book, is actually a synopsis in layman's terms. So there's for the nerdy docs, there's lots of little research papers in there, because this book also has 356 references, but a lot of them are, I remember the book is for laypersons, all right? So it's for basic, everyday mom and dad people and teachers or moms or students or whatever. But what was interesting was to go ahead and to show if you take any body part, it's going to affect you in another way. It's like a cobweb. No matter which way you go, it's all connected. It's just amazing. God created the most amazing creature that we are. And thereafter, it was like, God, this knowledge has to get out there. It's just too wonderful. It's just too sublime to just keep on a piece of paper in a drawer. And that was actually my journey to put it out there. So your knowledge on TMJ is eye-opening and has answered so many questions for me. So do you know anyone in the UK that understands TMJ like you? An X-ray shows my jaw twisted to the left. So that was one of the things, and I don't know if this is the person that emailed me, because I had to find the email. I was traveling, and I apologize profusely if I haven't. There are many, many resources out there. So there are organizations. My website, healthconnectionsdentistry.com, has an amazing amount of resources. There are an amazing amount of organizations that you can look. There's an amazing amount of research. So your jaw twisted, it could be for many different things. It's like, think of it as a jaw sprain or a broken jaw, or could it be muscle? Could it be nerves? Could it be the disc? Could it be, I mean, there's so many different parts that are involved in this jaw. And I don't know if the screen is going to stop it from being able to be seen. I'm going to try this here. So what happens is that there's so many different things that are involved. You really would need somebody who can understand this. Sometimes a chiropractor is a little bit more in tune with the issues than somebody who, remember, teeth. So I hope that helps. Another thing too is that a lot of people, and that's the play on the word, when you go ahead and you look at the book, when it says whole health, oh, I hope you can see it, whole health through balance, just like you'll see it on the website. That was me playing on the terminology being level. All right, that is super important. So when I treat my joint disorder patients, the whole idea is to make them level and to make it in such a fashion that this doesn't affect the atlas. So that doesn't affect all the way down to the toes. It's the sumo wrestler and the baby, you know, which side is the baby on, the bite and the jaw, or the spine and the atlas being the fulcrum. So if you can find somebody who's a little bit more knowledgeable in anatomy, if you can find somebody who's a little bit more knowledgeable in either restorations of your teeth and or new dentures or things of that nature, I think you will be pleasantly surprised that you will feel better. If the jaw's off to the left, it's left, right? It doesn't really matter. It means that something's off. Is it trauma? That's what happened to my daughter, trauma and the impact. Or is it just that you grew that way? You could have grown in such a fashion that you have one side longer than the other. Those are the ones that I see every day in the practice. And that when we put an appliance in there, you know, it levels them off. So the short side has that acrylic, so to speak, or that appliance that levels them off. And then the high side is now stable, which is what my research showed. I had a patient today actually, and it's so fascinating how in tune some bodies are. We did an adjustment on her orthotic. Now she has a discrepancy in her vertical. Same thing, vertical means one side was higher than the other. I did an adjustment last time. She left the office, excruciating headaches. Whatever I did, could have been I tightened the appliance too much, or maybe I tweaked it a little bit, excruciating headaches right there and then. She came back. I just unloosened the clasps a little bit, just tweaked the bite just a smidgen. Checked her neural tests. That was it. Instantaneous relief. She texted me just now and said, back to normal. I said, amen. Thank you, God. So a human hair is around, don't quote me too much on this, but it's around 21 microns. That's a thousandth of an inch, right? A micron. Human hair is around 21. You, proprioceptively, you can feel between your teeth up to 7 microns. That is like a third of a thousandth of an inch. That is so infinitesimally small. That is how we can proprioceptively determine how level or not we are. The other thing too is that the mouth houses many apparatuses, including the tongue. And I bring this up, and I know we have a myofunctional therapist on board here. That tongue that is so important, the fascia from the tongue goes all the way to the toes. Can you imagine what the mouth, how amazing this mouth is? So again, if you have a joint disorder and you have no room for your tongue, now we have double whammies and or things that are going to just a drop plus a drop plus a drop plus a drop plus a drop. So was that a good answer? I hope I did a good job. Oh, hi, Hillary. Good job. I'm so happy you're here. Hillary actually does havening. And havening is one of the things that I learned on holistically, Hillary, right? Holistically, I remember that. And havening is one of the things that 2 brothers did. One was a dentist and one was a psychologist. And guess what they did? They did a method of calming the body and then amygdala, the nervous system. And they actually use a lot of the cranial nerves. Isn't that the coolest thing? So that's how it's all connected. Just when you hear a little here and a little there and a little there, it's just interesting to go ahead and to see how we're all put together. And the exciting part is that the more you learn, it's like the more exciting it is. It's like, oh my God, so seriously, this is really great. All right, so I guess I did answer. I hope I answered the lady in England. I hope, and if it was you, I was going to respond. I found your email and I was going to respond tonight. So I'm very touched. You know, my dad was from England, right? Just in case you didn't know that. He was born in Reading and he migrated to Trinidad in the early 50s. That's a little side thing. And Trinidad was known as the land of the hummingbird, hence my hummingbird. I didn't want teeth on my business cards, but also Trinidad was part of the British Commonwealth. My accent. All right. What else? Holistically speaking, there you go. Thank you, Hillary. Sorry, I hacked that one up. Hillary also, so Chris has it to where on my website, Health Connections Dentistry, we have all the podcasts that these amazing interviewers have done. One of them is Lily McDermott, When You Need a Friend. We have a standing monthly. Hillary has interviewed me. Kathy has interviewed me. Brittany Scara from Mayo Air has interviewed me. Lots of different persons in their own wheelhouses have interviewed, asking me questions about their health concerns that relate to their body through the mouth, but also the children. So with that in mind, if nobody is going to go ahead and ask any questions, I want to talk about the children. Can we? I don't see any more questions. So can I? Chris, we're good? All right. We're good for now. Okay, so the children. I just finished a pediatric sleep residency, another one, right? And it is mind-boggling to see how we can grow adults. by how well we can help children develop. So one of the main things that you have to understand is you just don't get pregnant and have a baby. You need to start, it's like you get your farmer's soil ready. When you're on a farm, you till the soil and you fertilize, you do your mulch and everything. But that's basically what you're doing as a parent. You really should be getting yourselves healthy, detox everything for at least 2 years before you have a baby. Then there's the whole thing about during pregnancy, how to make sure that you're eating right, how you can develop this healthy baby. And there's a lot of neural and cranial development at that time. Birthing is another big thing. At birth and then lactation. So all these things are discussed in the book quite prominently. One of the things that brings very important to my mind is breastfeeding. How important that is, because every single time that child suckles, it actually creates a neural pathway and brain development is totally developed. Now, it's not to shame mothers who haven't or who could not breastfeed, okay? That is not the issue here. The issue there is if you can, please breastfeed. It's really good. And if you can, please, please, please do not put this plastic thing they put in your mouth that they give you at the hospital. I think they call them binkies or blinkies or whatever. They're not that good for you. There's nothing better than actually the breast, and there's nothing that's going to replicate its composition, its chemistry, and the actual nurturing of the mother. So even when you give a bottle, you're still holding the child, and those pheromones and hormones are still being transferred in a different way, that emotional component, right? So one of the things we're talking about, that cranial development, well, again, it's the tongue and the motion of the tongue that actually is going to go ahead and create that arch development. Also, when you create the arch development, you're also creating a large enough box. So I explained, I have a little tickle in my nose right now, sorry. If you go ahead and you have the upper being the shoe box, the lower being the shoe, and then the tongue being the foot, all right? The whole idea is to consider that you want to have a box big enough to house the shoe and the foot. Let's say, for example, in theory, we're supposed to have a size 10 shoe box, shoe and tongue. With everything that occurs, there's a little video on YouTube called Airway and TMJ. It's actually on my website too. That is the best 3 minutes you will ever spend, all right? What it does, it explains anywhere from ingesting, and the person who had the TMJ issue, you would love that video because it's going to really help you understand what and how the different components for the problem are. So again, the name of the video is, and I always jokingly use the term, the accent and the tonicity of the woman, Airway and TMJ. All right, so 3 minutes, priceless. So if you go ahead and you drink milk, or you have a lot of allergens or anything, a mouth breather, for whatever reason, you're not breathing through your nose, now you end up having a lot of swelling. The tongue can't go to the roof of mouth where it should, and then you end up having a very narrow palate. So I have my friend Fred. All my skulls are called Fred. So this is Fred. So if you think that the blue one is the actual cranium, this is the part where what makes my practice different is that this is what I work on. This. The average dentist, so to speak, or orthodontist, and that's what, again, makes my practice different. They're going to work on the teeth. But what we're going to use, and I know it sounds and looks a little crooked here, but what we're going to use is we're actually going to use the teeth as handles to move everything else and to fix everything else. It's magnetic, which is why it's having a hard time sitting together. This is the part that is primo. Everything is based on this. This is called the maxilla. All right, this is the part. Look at this. This is the above. The part that's the floor of the nose is actually the roof of the mouth. If you don't have proper tongue space or proper tongue position, you won't have a nice broad palate. The child invariably is not going to breathe, and they're going to end up having problems. So one of the things that I had a lot of insights already about what was going on, but what really came home and I'd heard a lot about it, but again, it seems that I'm hearing a lot about it now, is the death rate in children and adolescents. These children are dying, SIDS, probably the kids had sleep apnea, not saying all, and I feel my heart goes out to the parents who lost children that way. It would be interesting to find out, well, let's not go there, all right, but a lot of times these children cannot breathe, right? Correctly, all right? So they cannot breathe. And unfortunately, it's a lot simpler than they realize, but the physicians and the doctors have not yet married. And that's where I'm hoping SMILE could be the bridge between the fields of medicine and all the other professions, because you have parents who are looking and saying, my child's waking up, my child's wetting their bed, my child's anxious, my child has ADHD, my child is obese, my child's hormones are off, my child is autistic, my child, and on and on and on. And yet, very rarely are the children diagnosed or have an evaluation with their airway. Now, dentists see their patients ideally every 6 months, right? So if they're taught what to look for they're taught what to look for in the mouth, then that would be the first thing. The book is on Amazon, by the way. You can go to the website, Health Connections Dentistry, and there's a link, and you'll see it where to find the book, and you can get a direct link to Amazon. So the children cannot breathe. And unfortunately, as I was saying, the physicians are still, let's put them on the CPAP, let's do this, let's do that. And it's like, well, let's do tonsillectomies, let's do adenoidectomies, let's do what we need to do to surgically to fix them. But then if we were to make the box bigger, what if we were to go ahead and work with the parents on nutrition? A lot of these kids are given Twinkies, they're given chips, and I'm not talking about crisps, I'm talking about fries in the American way. Basically a poor diet. I always used to tell my kids when they went to school, when they were of age to create their own lunch boxes, I said, as long as there's something that's alive in that lunchbox, we're good. A fruit, a vegetable, and of course, I didn't buy them all the sugar drinks. They were, so that's where too you make choices. I know it's very hard nowadays with all the processed foods. I know it's very hard with all the chemicals and pesticides in the foods. I know it's very, very hard for a lot of people who don't have the money to be able to buy the groceries, but there's still a fine line for choices. Well, dis-ease. So you gotta make priorities. So the children, to get back to the children and the death rates in the children, that was where we were talking about the babies and then the youngsters. But what's really, really sad is the adolescents and the teens that are being put on antidepressants so young that are actually taking their lives. And that to me is heartbreaking, that you have somebody that neurologically cannot cope, and that also, and I know this sounds depressing, so we're gonna move on from there, but I think I'm seriously, I asked God to help me give the right talk tonight, and this is what's coming through. So I'm hoping that somewhere this is what somebody needed to hear, is that there is hope. You can save this. This is what makes what I do so amazing, is we save lives every day. We get people out of pain, but we save lives. And so the medications that sometimes adults are also on can cause extra clenching, extra pain, extra tension, could have side effects. And I'm not saying meds aren't necessary, but there's always this marriage. Remember, I told you I was freaking out when I was accepted to medical school because I didn't want to be in that boat. Well, now I know alternatives, so we don't have those situations. And as I said, I can help more people structurally, mechanically, functionally, because of making that box bigger and educating the parents, educating the adults also, saying, you know, hey, these are the options you have. You went down the rabbit hole. This is why you're where you are, more than likely. Let's connect the dots. And what do you want to do to get out the rabbit hole? So that's in a nutshell options. And I think, like I said, that child part was, I don't know, it seemed very important to talk about. What do we do? I recommend sleep screenings or sleep studies. That is the first thing. First of all, you can't treat what you don't know. All right. TMJ patient, more than likely you also have an airway issue, more than likely, because if the jaw's up or out, it's probably back also, which will mean that you'll end up having less of an airway. That could be something to look at. So the first thing would be to go ahead and get a sleep study. A polysomnogram is a study in a lab where the children would actually sleep and have monitors, and you have to take them to the lab. If they're above a certain age, you can have a sleep test done at home. We have that equipment. And then you got to get a person on board that understands this. So there are pediatric doctors who get this, and then there's the don't. And so we just have to pray and work through the system so that we can help more people. My other team members to help people, because I can't do it on my own, would be a good orofacial myologist, which I have. Chris's wife, Joanne, is my godsend. She's here in Brevard County, Melbourne, Florida, and who speaks my language. So it's like, thank you, God. And then again, a good chiropractor, a good cranial psychotherapist, a good nutritionist, and the list goes on and on. But as you can already tell, one was structural with a skeletal part, one was muscle, one was cranial. I mean, there's osteopaths. Have a patient, his mom takes him everywhere. He had certain challenges as a child, and he's grown into a fine young man, but it just amazes me the amount of things that she's done. And she always makes me laugh. She, you know, he'd come in for a visit or whatever, and I'll say, you know, can you go ahead and have so-and-so checked? And she'd say, okay, because she would follow through. Then about a week or two or three or a month later, she'll come back and say, you nailed it, Dr. Stagg. Yeah, the test proved X, Y, Z. And I think, okay, good. So now we know. And that's the whole idea, is to try to know what you're dealing with. I like doing things right the first time. I like to know what I'm doing. And again, because of the why, I'm going to learn what I need to learn so that when we go ahead and we aim for the bullseye. I don't think it's fair to throw stuff to throw stuff at the wall and expect something to stick. That's a waste of your time. It's a waste of your money and my time, and obviously my money too. So I don't think you'll get well that way. All right. I had a question. I know I talked a lot. What is my practice different? I think I answered that a lot. My practice connects, and I think that's super important. It is, again, how the book occurred and all. The next question I thought that was very interesting is, what is the best or newest or most innovative thing or equipment or idea in the dental industry in the present day that I would like to bring to everybody's attention? Well, actually, there's several. I was thinking the biggest thing we had trends. Everything goes by trends, right? So in the past, there was the TMJ trend, and there was the chemical trend, and there was this kind of trend. We've been on the growth and development trend, so to speak, in dentistry for the past, I would say, 15 plus years. All right. Implants, that was another trend. Dentures, that was another trend. So airway, I think, and I know I talked a lot about airway and we talked about it for the children. Airway is very big. It's coming back, and sleep. So the two are connected. If you don't have an airway, you'll have fragmented sleep, or you'll have sleep that's not good sleep. One thing to be aware of is not all apneics snore. Apnea, what's apnea? Apnea is when you stop breathing for more than 10 seconds at a time. That's an apneic event, all right? You'll be surprised when we look at the studies, the home sleep test, you'll see lines that are blue lines shows an apneic event. Sometimes you just have a blue bar, just like whoosh, all right? Those are when you have desaturation levels of oxygen that are like in the 80s. It's like, what the heck? How do you function? You have a really hard time functioning. So that would be airway and sleep. Not all apneics snore, but 80% of snorers have sleep apnea. That's the first thing. So that would be airway and sleep. That would be the things that I think are coming back big, or they're now being really expanded upon. And I think the American Dental Association is getting on board with that. The tools that are the most helpful for me, man, I couldn't live without my iCat. My 3D cone beam is such a blessing. It's a machine that literally, now I have a different type of machine that goes from hair to hair. It's called a double field of view, to where I get specific requirements. They call it the Stagg report because I asked for so many measurements. I paid twice the amount the average doc pays for it too. Not only do I look at the cone beam, but I have it read by an oromaxillofacial radiologist to catch things and measure things and quantify things that help me that I may miss too. You never know. And then that to me is priceless. The sleep screening, the sleep studies that I send them to do, I couldn't work without them either. So those two tools are very important. Where do I see this going? I already said this 10 years ago. Somebody from Italy called me, and I don't know why I started talking about, now people pick my brain all the time. And all of a sudden, a year later, you see my quote unquote thoughts or my inventions or my processes are out there. It's like, really? So my thing, and I'm going to put it out there because I really think we need this, and AI is getting big. But remember how the entire time I spoke about growth and development and developing the box, developing the shoe box, developing the shoe, developing the tongue. So remember in Star Trek to where they press on the hologram and everything just shows up? All right. I have this vision to where AI and the 3D, actually it's not 3D anymore, it's like 6 or 10 or 20D, to where literally all the parameters are going to be input in data. All the parameters are going to be put into a program to where there's going to be an initial scan, and then with growth potential, the issues that the patient's having. Okay, we're going to close up pretty soon. So basically, okay, that's all right, but I could continue talking for days, so I will need to start shortly. Okay, let me finish this thought though. This is because everybody asked me where I get my juice. I just have these visions of things and how they could be or how they can be, and I just put it out there, and I'm thinking, okay, come back to the thought. If we go ahead and we have a baseline and we have all the growth potentials and what's healthy and what we can do, can you imagine if we can just press a button? And I'm sure it's actually already being done. It's not out there for the public yet, but that's what's really cool is I'd be like, yay, the angel sang. I would be great to see it to where, just like in Star Trek, it's like, boom. So you have the exact 3D printed appliances made, and they have the sequence and everything. And that's what I'm looking forward to if this happens in my lifetime, which I know, I mean, sheesh, not even 15 years ago, I was seeing 3D printing for crowns. I was like, what the heck? And now they're doing 3D dentures. And I said that, it's like, whoa. And now it's in the book. It was like, and that's the interesting thing. I was writing the book when I saw that, and it hadn't really gone mainstream. And it's in the book to where maybe one day we can, and we are already. All right, so that's cool. All right, what question should I ask after getting the CBCT scan? Well, the question is really, what are you going for the CBT scan for? And that, I think, is not necessary. Should I ask after getting the scan? I think you need to know what you're getting the scan for. Remember, you got to know why. What are you trying to treat? What are you trying to get diagnosed? Once those are done, once you have a game plan, what is it they say? If you fail to plan, you plan to fail. Yes, that was right. So that would be what I think would be really important, is to know what actually is needed. What are your chief complaints or your concerns? What is it that you're trying to accomplish? And from there, move on to where you can actually get the right type of scan. So, for example, an orthodontist is going to have a different program to do a different scan. An endodontist, which is the guys or gals who root canal treatments, they're going to have a totally different view and apparatus to do the scan. And a general dentist is going to have a different type of scan. And a surgeon who takes out wisdom teeth and who does implants is going to have a different software, probably also a different piece of equipment. So the question, what question should I ask after getting the CBT scan, I think should be instead, what is it that I do need? What is it that I have that it's CBCT? Oh, no, that's not even the question. The question would be, I have XYZ issues. What type of scan would best suit me or work with me best? So voila. I think a lot of the questions that were given to me were about TMJ disorders. I know I digress a lot on airway. 99.9% of patients who have airway issues have a joint disorder. If not 100%, it's practically automatic. Are they hereditary? No, not necessarily. Now, if you go ahead, you have a genetic gene pool to where everybody ends up like Bucky Beaver, more than likely, yeah, you'll end up with a joint problem. In that way, it's more of a structural hereditary thing than actual a joint hereditary thing. Another big question I had a lot for was xylitol. Why do I promote xylitol a lot? One of the big components in the book is the chemical component. So remember, it was structural and then chemical. For those of you who are not familiar with it, there is a big controversy with mercury. There's a big controversy with fluoride. Now, I don't need to get on anybody's soapbox right now. It's not going to be making any political statements. I have all the research you could ever want to read and more on the website. Go have at it. But I was looking for an alternative for fluoride. And I found one, and it's xylitol. So a lot of patients have a lot of sensitivity, and they're looking for natural resources to be able to help them be desensitized, as well as remineralize, as well as have a means of cutting back on what we call the biofilm in the mouth. Biofilm, imagine the egg white around the egg yolk. The egg yolk being bacteria. The biofilm is that gooey substance that just protects the yolk, so to speak. We get it all the time. We have it. I mean, you get your teeth clean within seconds, it's formed again. So that biofilm is protecting the yolk. The bacteria in your mouth cannot eat xylitol. They can't digest it, so they die. And we like killing bad guys off. We do good guys, we keep the good guys, but the bad guys eventually die, and it keeps the count that of the bacteria down considerably. And those are usually the ones, the fact that the bacteria eats the plaque, they produce acids, and acids will eventually lead to decay. So it's an alternative to help plaque control, and hygienists, I think, should be a lot more aware of it. It's an amazing alternative. It's a very economical alternative. It's produced naturally in nature. One thing I'm going to tell you, actually two things. One is do not let xylitol gum or the little sweets or sugar be ingested by animals or birds, because it is toxic to them, not humans. We're not dogs or birds. We're humans. So it's good for us, but not for them. And then the second thing is, I totally forgot what I was going to say. It's not toxic. It occurs naturally. It comes in every different way that you can think of. You can get it for your nasal sprays, which will help a lot with your airway. It'll help a lot with your airway, so upper airway, lower airway. And I totally forgot one other thing I was going to talk. It's not toxic. You have it in brush, in toothpaste, good alternative to fluoride. And I totally forgot the animals. I wanted to make sure the animals were taken care of. So I'm sure as soon as I hang up, I'll remember what it was I wanted to say. And it's very economical. Your dentist would have it. So at least, oh, I remember, sugar. All right. Very important. Very, 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 very important. Same thing. So just the same said that you get xylitol in a lot of products. Well, at the checkout counter in the grocery stores, you'll say made with xylitol, right? Be very careful. Read your labels. If you see phenylalanine or aspartame, those are the artificial sweeteners of any kind. Those are actually neurotoxic. So you're not getting, just like diet anything, you're not getting the benefit of the xylitol. Rephrase it differently. The toxicity of the chemical that's added, which is an artificial sweetener. And I don't know how you can make xylitol even sweeter than what it already is, but you're downplaying. The cons outweigh the pros 100-fold if you do the artificial sweeteners. There you go, in a nutshell. All right. What questions? Okay, so I think we're all good. I think we did good. I think we're wrapping up close to an hour. I have maybe a few more minutes. Any other questions? Anybody? Ask now. However, hold your peace. I'll be happy to do this again. We had a little bit of a anxiety going here. We did, but look, we came out like champions, did we not, Chris? I'm so proud of us. Thank you so much. Really appreciate you a lot, a lot. And we can thank Chris for my background. It's so cool, my book. Actually, I have to say, so this is really funny. You see that stack of books that the person wanted to know where to get Smile. That same stack of books that is on there on my back screen. I have 1, 2, 3, 4, 5, 6 Smiles, the books that I was actually holding my laptop up as my prop for my computer. I think it's so hilarious. Yeah. All right. I think I I have to put my plug in. So can you see my other little guy, my other little book, my children's books, Captain IFBI. So it's on the website too. That has xylitol in it. It has it teaches children. I have to tell you how that came to be. I was in the throes of trying to get Smile out there. It had been 10 years I'd been working on this baby, massive encyclopedia that it is. And then I had this children's book and I just saw it. And I wanted to do something that would unite. There's nothing more unifying than a smile that brings people together. And so I created a little character called Captain IFBI. So Captain IFBI stands for Irrigate, Floss, Brush, Irrigate. And so Captain, champion, Captain, especially Captain and the men in blue at the time. This is back in 2020 or 2018. I can't remember, when police were having a really hard time and the police officers were very touched that I donated one to them. I said, yeah, my men in blue, my captains. Anyhow, long story short, Captain is a little character. He's my hero, and he goes around to children's bathrooms all around the world, and he teaches them all about home care, periodontal disease, well, gum disease and bacteria, everything. So everything I talked to you that might have been a little bit technical is in simplistic terms. It's a really, really, really sweet children's book. Its subtitle is Story Time. I used to read to my children all the time. That was mama time. I was gone all day, and then I'd come home and work again. But after their showers, we made time to read stories together, and just talking about it tears me up. But that was precious for me. That was where we had our bonding time. So when I had that, I wanted to write something that the parents could hold their children, bond with them, hold them tight, love them. And the book is about love and unity. I'm so sorry, this is very emotional because it's bringing back so many memories of my children, the times we read books together. So there are about several countries all around the world. There's France, there's India, there's different countries, and that's part of the pleasure, is that I wanted to make it countries that were special to me. And growing up in Trinidad, there's a little character, my little Trini boy with a Trini flag, with the Jamaican Rasta colors and cricket. There's India. Trinidad has a lot of Indians. There's France. I went to down school in France. My mother's French, and on and on. So there's different. Xylitol was Swiss, and then Russians. Russians are big. So I wanted the whole world to be united in love. And actually, that's what it is each child, sometimes it's a father, sometimes it's a mother, and there's always a parent there to guide their child. And it's a very profound book when you read through the lines about love and unity. And at the very end, which to me is, and I made sure for America, I could have put New York, but it was really a very important point for me that we have the Native American. Sorry, I don't know why it's, I just think that so many people have suffered so much in this world that this was supposed to be a joyful podcast. The whole idea was to make everybody happy, and with teeth and smiles. So I'm so sorry. Don't know where that came from. But every time I talk about Captain, and I get happy, joyfully sad. Does that make sense? Joyfully sad. All right. I'm probably a big mess. Yeah, big mess. Sorry. Don't usually clean up yourself on a podcast. I podcast, do you? All right. So I apologize. All right. I look decent now, Chris. All right. So that was Captain. Sorry about that, but Captain was that was a good interlude to smile, because actually what happened is we wrote I was writing Smile and editing and layouting and writing and editing and layouting, doing pictures, and then finally I had this interlude of Captain, and that was fun. Went ahead and did that, and then got it out there, and I was like so excited. And oh, by the way, you don't know this, Chris, but a friend who was so excited when I told him about when my book came out, ordered Captain FBI for his child, and they are so excited by the response of their child that it is possible that they wanted to possibly do Captain in a movie to help with the proceeds going to help at a local film festival, with the proceeds going towards helping disabled children. Isn't that cool? Yeah. Yeah. Keeps going around the world, right? All right. So, okay, so I think we're getting close to an hour, which is quite a lot. I've talked a lot. I've laughed, I've cried. Chris, is there anything you think that anybody should know before, like, forever hold their peace, like for this session? All right. Chris said nobody can hear him but me. So Chris basically said that we're good. I apologize profusely for my outbursts and tears. I'm so sorry. I really am. But like I said, that was a very emotional. My children mean all the world to me, just like I'm sure many parents do. And that actually is why the book, The Media That Is Smile, was written, is because I repeated myself day in, day out, every day. And we need to save the children. We need to get those little kiddos out and have normal lives, because they're our future. They're the ones that are going to be the world that we are going to age in. They're the ones that are going to be looking after us, God willing. But also they're the progenitors. They're the ones that are going to create the next generations and the next generations and the next generations. So I think it's important that we help grow responsible and healthy youngsters that will then become responsible and healthy adults that will be happy. And that I think is really important, is to have joy and passion and eagerness for life. And you can't do that if you can't sleep. You can't do that if you don't have a healthy life. It's easier to build strong children than to repair broken men. Thank you. That must be from Vicky. Vicky probably is a good friend, but that is very true. It's easier to build strong children than to repair broken men, by Frederick Douglass. So voila. On such a note, the last little saying on Joanne's website. Okay, well, on Joanne's website. So thank you, Joanne. On that note, I am going to finish with my last quote in my book, Smile, that says, "You are not a drop in the ocean. You're the entire ocean in a drop." With that, thank you for being present. Thank you for sharing this hour with me. And what did Mr. Rogers say? A friend in the neighborhood. See you till next time. God bless. And French would say, au revoir, à bientôt. Thank you again.